Hello, everybody. Hello, hello, hello. Thank you so much for joining me today on your Health Matters program. Hello, everybody. Thank you so much for joining me on today's episode on your Health Matters program. Thank you so much, everybody. You're welcome. How was your day? Today is actually the 57th edition of your Health Matters program. I want to say a big thank you to everyone joining. Please share the video. And we're going to start the program by welcoming our guest on today's program. This is one of our GP, and he's actually been here before. Please join me to welcome Dr. Sebastian Morris. You're welcome. Please introduce yourself to my audience.
Hi, thank you, Elizabeth, for having me on. It's my third time with you, I think, on the show. So very glad to be back. I'm a GP. I've been working in the UK as a doctor for about 9 years and specialized as a GP working in East London up until recently. And yeah, very happy to be on here with you today.
Thank you so much. Really appreciate. So, as we all know, today we're discussing apnea, sleep apnea. So, what is apnea, Dr. Morris?
Yeah, so sleep apnea is a medical condition that causes people to stop breathing during their sleep for very short amounts of time, sometimes just a few seconds, but this happens many times throughout the night. So sometimes it's 5 times an hour to up to more than 30 times an hour. And it's a common condition that many people don't know that they have. So in England, they estimate that over the age of 40, somewhere between 1 in 6 to 1 in 4 people may have some degree of sleep apnea. And it's a condition that causes lots of effects on your body. And the main thing people feel is extremely tired and often falling asleep during the day. But over the course of many years, it can have other effects on your body and make your health worse in many ways, which we can go into.
Wow, thank you so much. So, you said earlier on that this points. So, how does this affect the body?
Yeah, so to kind of understand what's going on, I'm going to describe what's going on within the body. So imagine when you're sleeping, something is physically stopping you from breathing. Sometimes, like I said, just for a couple of seconds, sometimes for 10 seconds or longer. And it keeps happening many times throughout the night. So in these moments, the oxygen levels in your blood drop just below normal, and your brain is not getting enough oxygen. So that puts your body under stress. And your brain responds by asking your body to increase levels of hormones like adrenaline and cortisol, and asks your heart to work harder than normal to pump more blood around because the oxygen levels are low. So when your body and your brain is meant to be resting during sleep, it's actually having to work even harder. So this leaves people like when they wake up during the morning extremely tired. They feel like they constantly need to sleep, sometimes even drifting off to sleep in the middle of conversations, to in even more severe cases, falling asleep when they are driving. And this constant stress on your brain and your body over many years increases the risk of other medical conditions like blood pressure, heart failure, increase the risk of your stroke, and make other conditions like diabetes worse.
Wow, that's quite alarming. I'm learning actually. So, you know, this is actually something we just realized, at a certain stage, people actually develop. So, what are the different types of sleep apnea that we have?
So there one main type, which is obstructive sleep apnea, which happens because there's a physical cause, which I'll go on to in a bit, that happens to block you from breathing when you're sleeping. And then there's
Mm,
another rarer type, which is central sleep apnea, but that's more a signaling problem between the brain and the muscles that help you breathe. So that's much rarer and occurs
mhm.
in certain conditions. But the vast majority of people, when we talk about sleep apnea, suffer from obstructive sleep apnea, or
Wow.
what they call you. You'll hear the acronym OSA.
Mm. What are the causes, Dr. Maurice?
So when someone is sleeping normally and they don't have this condition, it's normal that the muscles in our body relax. So the main issue is in the airways. And
Okay.
when we're sleeping normally, the muscles in our tongue and throat and the soft palate, which is the soft bit on the roof of your mouth towards the back, it can relax a bit as we fall asleep. And usually that doesn't cause any problems. But for some people, those tissues relax too much and the
Mhm.
airway becomes narrow or even closes completely for a few seconds. Now, the best way to kind of picture this is say, when we go to like McDonald's, Burger King, they give us like paper straws these days. And
Mhm.
after a while,
Mhm.
they get wet and a bit floppy.
Yeah.
And when you
Yeah.
suck a drink in, the straw collapses in on itself and you can't get anything more.
Mm.
So that's kind of what's happening within your airway. So this causes that drop in the oxygen levels, and your brain senses that. And to try and stop that, it tries to wake you up, even if it's just a split second. So when you're meant to be in sleep, the oxygen levels drop, your brain wakes you up, and then you start breathing again, and then it may stop again, and it keeps going on. So and people often don't even remember or realize this is happening. So your body's fighting to breathe all night, and you're not aware of it.
Wow.
So
That's
there are
actually,
many, yeah, yeah, yeah. Sorry, what were you saying?
yeah, go on.
So saying there's many causes and like risk factors that would lead a person to develop it. And the main one of the main things can be being overweight.
Okay.
Um, Sometimes it can be your anatomy, the way
Mm.
that your neck and your jaw is as you grow up.
Mhm.
Um, your age and your gender can play a role. So it is more common in men, the initial stages. Sometimes the way people sleep, for example, lying flat on your back. And if you have those above conditions that I mentioned, like being overweight and a particular anatomy, that makes it more common. Other things like alcohol, smoking, problems with your nose, and sometimes even family history can also uh, add up to you developing sleep apnea.
Thank you so much. So I'm just going to quickly change the network because I was told that the
Sure,
network is breaking a little bit. Just stay online with me. I'm just
sure,
quickly
sure.
sorry for that
No worries.
interruption. Let's just quickly change so that we can enjoy the program. So we don't want actually information the doctor is giving us. And that's it, we're back. So come back everybody. So I just want to be sure Dr. Morris is still online.
Yeah, I'm here.
So good, well done. So that's actually a bit detailed in terms of the courses.
Yeah.
So I think one of the things you mentioned earlier on was how does obesity contribute to the development of OSA?
So when it comes to obesity, it affects
Mm,
sleep apnea when someone can carry extra weight around their neck, because that
mm,
extra weight around their neck would put extra pressure on the airways that I mentioned. So, like the tongue, the roof of the mouth,
mm,
your throat, and that extra weight makes
mm,
it more likely for that airway to collapse and to cut off the oxygen when you're sleeping at night. Other people, like depending on how their body is, if they carry a lot of weight around their belly or on their chest, again, it puts a lot of pressure on their lungs. So as someone is breathing in, they're having to breathe in against the extra weight that they're carrying, which makes it harder to draw air into the lungs. And also some on top of that,
Mm,
obesity over a period of time can also cause the body to confuse certain chemical signals where your body becomes less sensitive to hormones that may control your breathing. So you've got a mechanical problem and a slightly metabolic problem combining together from obesity to uh,
mm,
cause sleep apnea.
Thank you so much. So I think you did actually touched on the second, my next question that this sleep apnea affects cardiovascular physiology during sleep. Okay, can this cause a heart failure? Because you just explained earlier on to say they stop breathing at
Yeah.
interval all through the night.
Yeah, so like it can go into more detail as well to make people understand like how that can happen. So this doesn't happen straight away. It happens over many years. But those moments
Mm,
where you stop breathing and your oxygen levels drop, the brain's telling your heart kind of work faster, beat faster. It asks the blood vessels to tighten up so that your blood pressure goes up and your body's going into a bit of a fight or flight mode, even if it's for a short period of time, but sometimes can be many, many, even hundreds of times a night. And when you're trying to kind of breathe against the blocked airway, the pressure inside your chest can increase as well. And that makes the strain for your heart much more. And over time, this can add on to high blood pressure. And then your heart is working against the high blood pressure. It can increase the risk of electrical problems within the heart, like atrial fibrillation. And this strain over many, many years could contribute to developing heart failure. But the good news is that with sleep apnea, because it's a very treatable condition, once the sleep apnea is treated and people will notice recovery straight away in their symptoms, and it can often help the heart recover. So it is not a condition that it's a very treatable condition. The hardest thing often is picking it up and diagnosing it because people are not often aware that they have it.
wow, thank you so much. That's actually really good to know. So let's go into the clinical presentation of this issue. What are the common symptoms patients that you've seen maybe in your work experience have actually presented with that
Yeah,
people can then start knowing that, oh, this is coming around, this is actually, because a lot of people sometimes start with snoring, and
yeah,
at what point is snoring and becomes a sleep apnea?
yeah. And that's a very good point that you raised about snoring. Uh, Good thing is not all snoring equals sleep apnea.
Mm,
Yeah. But it is something that's often associated with it. And something that we often hear as doctors when someone comes in, they say with the snoring, one of the questions we ask is, has anyone else noticed that when you're snoring, you stop breathing? So if someone does sleep in the bedroom with another partner, and that they do notice because obviously snoring is a loud thing and it can affect partners as well, but they notice when suddenly there's someone stops snoring and they don't seem to be breathing for a while and then they start snoring again. So that is a very interesting or key part of the information that I would look for. Another thing I would ask is, do they find themselves suddenly waking up, like suddenly choking or gasping during their sleep, like they can't breathe, and then they are able to go back to sleep. So that those are the things that might happen during the sleep. The other very common thing, and sometimes people don't realize it's linked to this, is feeling very tired during the day. Can you still hear me, Elizabeth? Hi there. Can you hear me now?
Yeah, sorry,
Yeah,
I can hear you now. The network is just messing around. So sorry
that's
to all
okay.
the audience. We just actually lost connection again. So I think
So
the next question I was
where did you
actually, yeah.
yeah, so
So
where did you hear up to?
so I think people couldn't hear you online because I
Yeah,
can see
okay,
that you keep talking
sure.
online. I
Okay.
think it was my network
Yeah,
actually that messed around. So
no
so
worries.
thank you so much. So we just
Yeah,
go to the next question. So how might apnea manifest differently in children compared to adults? Because I think we've seen that in the past it used to be like adults problem, but now I think I've seen other children having this difficulty. So how does it manifest differently? Is there any difference? Are they the
yeah.
same thing? Do they carry the same risk?
Um, it can be slightly different in children, but just to go back to finish my last question. So apart from that snoring, like waking up, choking, gasping, stopping breathing, I just wanted to speak a little bit more about the tiredness, and then we'll be able to go on to children and see how it is different. So the tiredness, like a lot of people come to a
Mm,
GP saying, I'm feeling tired all the time. And we would obviously
mm,
need to do many tests to make sure there's nothing else contributing to it. But
mm,
this tiredness from sleep apnea is sometimes a bit more than just normal tiredness. So I mentioned at the
mm,
start how people sometimes fall asleep during conversations. So it's that daytime sleepiness that is the key thing. So one of the things that we would do when a patient comes to me with potential sleep apnea is we go through a questionnaire to assess how severe that sleepiness can be. So this would be, for example, like to give examples of the questions that we would ask is, if you were sitting in a bus and
mm,
the bus was to stop at traffic lights, or just during the
mm,
journey, how likely are you to fall asleep?
mm.
If you're driving yourself and you're at the traffic lights, do you find yourself falling asleep?
Okay.
Do in the middle of the day, say after lunch, not having had any alcohol, do you feel like
Mm,
you need to have a nap and you end up going to have a short nap during the afternoon? Um, so there's about 15 questions or so when we would kind of get a score of how much sleepiness affects you. And
mm,
that's one of the main things with sleep apnea is that tiredness people feel during the day. And
mm,
another thing that we often screen for is when people present with high blood pressure for the first time. Because one of the first long-term effects of sleep apnea is high blood pressure. So when we get a new patient presenting with high blood pressure, I often ask these questions
mm.
as well, because it can be a very easy treatment for high blood pressure. If you treat the sleep apnea, then the high blood pressure can improve itself. So when it comes
Mm,
to kids, you're right, it's now slightly more common to see kids with sleep apnea as well. One of the causes is can be similar to adults in the sense that there are more children who have obesity as well, and that can play a role.
mm,
But often it's
mm,
more issues with their immune glands, like the adenoids or tonsils. So
mm,
children who have enlarged adenoids, these are the glands that just sit kind of behind your nose. They're not very easy to see, but they can get quite big in some young children, stops them from breathing at night, and also if they have very enlarged tonsils. So a typical thing might be that it might be one of those children that constantly gets, recurrent throat infections. And when the doctor examines them, they can see quite large tonsils. Or I've sometimes had children come in, very young children, where the parents say, my child is snoring a lot. And it's not common for a child to be snoring. So in all those cases, we would refer them to the ear, nose, and throat specialists for them to,
okay,
look
ENT.
inside with the camera, see how big of a problem it is, and see if that needs
Mm,
treatment. In children,
mm.
that might be surgery to remove the adenoids or the
I don't
tonsils.
hear.
But the
Mm,
symptoms are different often in children, where it's not tiredness, but it
mm,
can be that they're restless during the day, irritable, or a bit hyperactive. But you have to
mm,
have that those symptoms along with that problem, often with the enlarged adenoids, tonsils, snoring, uh, constantly noticing that they're mouth breathing rather than breathing through their nose. So that's how it
mm.
would be different in children.
Children. Wow. So that's actually a very good information for the parents. If you think your child is snoring, and please keep an eye on them. to ensure that actually is actually not an apnea and they are this thing, you can consider referring them, speak to the GP, they can refer them to the ENT. So that actually takes me to the risk factors and the associated conditions. So what are the most, I think you've touched on few of them. What are the most significant risk factor for developing sleep apnea? What is that particular risk that we need to be aware of, that as soon as this is happening, this is actually like not safe anymore?
Yeah, so to develop sleep apnea, like I said, yeah, one of the being overweight, obesity is one of the big issues. Having an enlarged neck size, carrying a lot of weight on your tummy. So if you sleep on your back, that extra weight is kind of putting pressure on your airways. And age, so it's more common over the age of 40. So if you notice that if you're approaching that age, then you notice that someone in your family is snoring a lot, but they're also having that, they stop snoring, they stop breathing at night, waking up gasping, choking, or they along that same time they're developing other things like high blood pressure. It's important to ask that question then to your doctor: could I have sleep apnea? If you have family history, so if you know that someone in your family has been diagnosed with sleep apnea, you could be twice as likely to develop it in your lifetime. And another key thing is that, say, I've had patients who, when they were younger, had accidents where they've broken their nose, for example, or they've had to have previous surgery within their nose. So some people may have issues with their septum, which is the division inside the nose. If that is a deviated septum, and that causes problems with their breathing, then that can also contribute to sleep apnea. And the other conditions that you said is associated with it, I think previously I came here and talked about metabolic syndrome, and it can all be linked together as well.
The network is so. Thank you so much. Welcome back. I actually lost connection just now. If I lose connection again, I'll just connect to my phone, and maybe that will actually be much better. I needed to kind of please repeat the last phrase of
Yeah. So from all the kind of the risk factors, like we were going into, like I was mentioning the last time I came on, I think I talked about metabolic syndrome, and so it can be connected to that. So like having obesity, an enlarged neck size, getting older, like particularly over the age of 40, the risk of this increases. Uh, Being a man can increase the risk of this. Having family history and previous accidents involving your nose or any surgery involving your nose can increase the risk of this as well.
Thank you so much. Um, you did mention something just now which kind of caught my attention. So is that a hereditary or genetic predisposition to apnea? Is there any link, correlation to somebody actually, because you talked about it could be hereditary or genetically on?
Yeah, so from the research says that if you have one close relative, like a parent or a sibling, that has sleep apnea, you might be twice as likely to develop sleep apnea in your lifetime compared to someone who doesn't have that family history. But it goes together with like the other risk factors as well. So obesity particularly. Now, the uh, traits that you may inherit apart from the risk would be things like certain anatomy, so the shape of your face or jaw. So someone who has a particularly smaller lower jaw, or narrow throat, larger tongue, that can all run in families. Sorry, my daughter's just coming
That's right.
in.
You're welcome. You're welcome to join us on the show. It's actually, that means That means the child is interested in medicine. Don't worry, your dad is a GP. So you're welcome. So there's actually, before we proceed, please you can call in. I know somebody came their day, please you can call in if to ask your question. Can one of the admin please put the number on the Facebook? So I'm gonna take in because sometimes I'm not able to start taking or reading your I'm not able to read your questions while we are live, but please do call in of bringing professionals on the show. So you don't have to mention your name. Please feel free to actually call in and just ask the question. So the number to call, I'm opening the line now. The number to call is 073 804 03268. Please, you can call in and ask the doctor any question. If you're calling from abroad, you can call in on WhatsApp number. You understand? You can call it on the WhatsApp number, and then obviously if you try the WhatsApp number, if not calling, use my WhatsApp number, and we can get your question or put it on the Facebook thing. So there's a question from somebody on the Facebook. What about a child that the tonsils has been removed and still snores and breathe through the mouth? So they've had the operation done for tonsils and they're still snoring and still have to breathe through their mouths. What can you recommend? What do you think they should do?
So that point would be ideally a second opinion from the ear, nose, and throat specialists. So it would depend on the surgery, because I mentioned about the two glands. So there's the adenoid glands and the tonsils. So they're slightly different. So the adenoids are ones that you can't really see when the child opens the mouth. That's kind of sits behind the nose, and that's only seen when they sometimes put the camera through. So that can still kind of block off their nose. The other causes can be sometimes children have what we call chronic rhinitis. So that's inflammation kind of within their nostrils. So their sinuses can be very inflamed and blocked, sometimes due to allergies. And that persistent blockage leads them to constantly breathe through their mouth. So if having the surgery has not really solved the problem, then the best thing would be to get seen
We'll
by
pick the call and we'll continue.
Sure.
Hello, you're welcome to today's Your Health Matters program.
Hello, good evening. You guys are doing very good work. And Dr. Maurice, well done for your presentation and explanation. I just have a question. Can you hear me?
Yes, please, go ahead.
Okay. My question is, yes, we have this client suffering or having this condition. The people around must be suffering too. How do we support the people around to actually cope with this condition, because they're probably not aware that this condition exists, or they're hearing it for the first time? New to them. How do we go about supporting relatives and family of clients who have this condition, so that they'll be able to support this client, patient that have these conditions? How do we support them? Otherwise, some houses could be burnt down before they actually know what the situation is. Thank you.
Thank you so much. So I want to clarify before the caller drops. So are we talking in terms of partners sleeping together and the effect is having on them? Are we talking about client approach in this instance?
Yeah, we're talking about husband and wife.
Okay.
Together and this condition developed.
Okay, thank you so much. Over to you, Dr. Maurice.
Yeah, a great question. And you're absolutely right. It's a condition that can affect the whole family in many ways. So my opinion is the first thing is recognizing that someone might have these symptoms and then going to the doctor, hopefully getting referred for the tests to confirm that if it is sleep apnea. Now, then we can go on to like the diagnosis and things. So once then you're diagnosed, then you get the treatment, which is the machine, then it can really improve the symptoms dramatically. But you're absolutely right that many many different aspects of sleep apnea can affect the whole family. So one can be the snoring, which can be very loud, and that can affect the person that is sharing the same bedroom, disturbing their sleep. So not only do you have just one person who is tired from not having a good night's sleep, the other person is also tired. Then hopefully things should be improving now. But once you start getting the treatment, previously the machines also used to be loud as well, because we can go on to that in a bit more detail. But people find it very difficult to use the machine to help them with the sleep apnea consistently, because it was not comfortable or it was too loud to be used in the bedroom as well. But that is improving, and we can go on to that as well. So the main things is the diagnosis and getting the treatment, and the treatment is not just you get the machine and then that's it, goodbye.
Okay.
Every person who's diagnosed with it has their own sleep nurse who they will have routine follow-ups, and their job is there to kind of troubleshoot all the little problems that you will have with sleep apnea. So it's not just, here you go, take this home and that's it. The support is there even in East London. I think we used to refer to Queen's Hospital or
King
the
George.
Homerton,
Okay.
and the sleep team, the nurses, they would routinely follow people up. And
Okay.
the important thing is to bring up those issues so that they can be dealt with, because it's a treatable condition. It can make a huge difference in your quality of life once it's treated. And
Okay.
these days, the technology is improving, that the machines are smaller, they're more comfortable and quieter as well.
Oh, thank you. So that would take me, thank you so much, Kola. So that would take me to, let's talk about diagnosis and evaluation.
Yeah.
So what is actually the gold standard for diagnosing sleep apnea?
Sure.
I think
So,
you've touched a bit of
yeah.
a base on it.
Yeah, so we'll talk about that in
So,
more detail. So starting right from like when you go to your GP, we ask a couple of questionnaires to calculate the risk of you having a sleep apnea. So based on those questionnaires, if your risk is very low, that's great news, because it's unlikely that you do have a sleep apnea and you may not need further investigations. But often with the history that I mentioned, it's quite common that the score of those questionnaires is high enough that we refer you to the sleep clinic.
okay.
The sleep clinic is run by the respiratory doctors, the lung doctors, and they carry out sleep study.
Okay.
Now, again, it's technology has advanced so much that in a lot of clinics, they actually just send you home with the equipment, because the way it's diagnosed is monitoring your breathing, your oxygen levels, your heart rate through the entire night. So sometimes you're just sent home with the equipment, painless, that just monitors your sleep. It counts how many times in an hour that your oxygen levels may be going low, you're not breathing strong enough, or whether you completely stop breathing. And they get a score at the end, which tells you whether you have no sleep apnea, mild, moderate, or severe. Sometimes in certain clinics, it might be they don't have the equipment at home. So in those cases, they bring you into the hospital to sleep in the clinic overnight, where they have more sensors to look at how your breathing is. And for some clinics will send you with the home equipment first, and if they find that there could be something more going on, they need to do a bit more studies, then they might bring you into the clinic to do the more tests, because sometimes other things can be affecting your sleep, such as restless leg syndrome, for example. So it might not be that you have obstructive sleep apnea, but you don't get a good night's sleep because of restless legs, which still gives you the same symptoms. So that's where the tests may be more detailed. But these days, ideally, you should be sent home with some equipment that monitors your sleep, and then you get a score of whether you have it, whether it's mild, moderate, or severe.
Thank you. So I think what I had, and which I think the same thing everybody on the Facebook ad is about, there's a treatment plan, and this can be managed properly. So I think you've talked about the first line treatment for obstructive sleep apnea. So let's talk about the PAP machine, or is it
Yeah.
CPAP machine? Let's
So
talk a bit
yeah,
about that.
before I just go on to the machine, one of the things I wanted to say is that quite a lot of sleep apnea, these can be treated even without the machine by just
Oh,
treating that first main risk factor, which is obesity. So
mm,
especially in cases like it's mild and sometimes even moderate sleep apnea,
mm,
losing just 5 to 10% of the body
yes.
weight can relieve that pressure that the weight is putting on the airways and treat sleep apnea that way. So it
Mm,
doesn't always necessarily mean that you have to have the machine to improve the sleep apnea. The first thing always should be, once it's diagnosed, doing the lifestyle changes to see if that can be treated first. But of course, if it's severe, then the CPAP machine, which we'll go on to now, is the best treatment that's there.
mm,
So the CPAP machine these days, it's a small machine that can sit on the bedside table. It will have a
mhm,
tube and connects to a mask that you put over your face.
mhm,
And again, an
mhm,
important point is that the mask is ideally custom fitted to your face so that it is comfortable
mhm.
for you to wear whilst you are sleeping. And then, whilst you're sleeping, this machine just blows air at a very slight pressure to just keep your airways open throughout the night to stop those incidents where you're not breathing properly or you stop breathing. So, going back to that floppy straw, so there's air just blowing through it, kind of keeping the walls of the straw just open so that you can breathe easily throughout the night.
That's actually good. So please, you can call in. The numbers is actually 073-804-03268 to ask more questions. So that's actually really good. Let's talk about I think you've mentioned about the machine now. So what are the difficulty using this machine? I think you mentioned a little bit earlier on. So
Yeah.
can we explore more?
Yeah.
Is
So
there any
one
risk we need to be aware?
So the main thing that patients have come back to me is that they find it uncomfortable to use the machine through the night.
Mm,
And sometimes it has to be, like I said, the mask, the fitting, all those things has to be troubleshooted with your sleep clinic nurse to get the right fit. But the ideal kind of what they say is to slowly build it up. So for example, if it's the first time you're getting the machine, um, and you feel uncomfortable wearing it, it might be that you want to start wearing it for short periods while you're watching TV or reading so that your body gets used to it a little bit. If you find that the mask is too tight or causing pressure or pain on your nose, that's the point where you go back to your sleep nurse where they can try a different mask or make sure that you have more padding so that it's comfortable for you. The other problem that sometimes people come back with is that they find that it makes their nose very dry or gives them the sensation that their nose is blocked. That's because you're breathing that pressurized air. But these days, the machines are sometimes have built-in humidifiers. So with a bit of water, that they blow in some kind of with humid air that helps prevent the nose from becoming dry or blocked. The other thing that I mentioned, I touched on earlier, was the sound. So again, these days, as the technology is improving, they're they can be very quiet. So just kind of they say like the minimum kind of noise to have a good night's sleep might be 30 decibels, which is just kind of like background noise. So there are machines that are built to be no louder than that. The another problem they sometimes people mention might be again difficulty breathing out. So breathing in and exhaling because you've got the air being blown in. But again, that just needs to be fed back to the team so they can just adjust the settings in the machine so that there's not that much pressure going in. And there again, now even machines that detect when you're breathing in or out to slightly lower the pressure when you are breathing out so you don't feel that sensation, that discomfort. So just to summarize, like the most common things that people come back with is that they find it uncomfortable to wear, which I always suggest get the mask fit like checked. Dry nose, which can be treated like there are machines with humidifiers built into it. And the noise, which over time the technology is getting better, and there are machines that are really quiet that
Right.
doesn't affect your sleep as much.
That's actually good to know. It's not like there's any clinical risk. When is surgical intervention required? At what stage after um somebody has tried all the identified intervention? At what stage do you think surgical intervention is required?
So that depends on the if there is like another physical blockage. So like we mentioned about children, so if they have those big adenoids or tonsils, that can be something that's surgically treated. Um, in adults, I touched on it earlier. It's like say someone had a broken nose when they were younger, and the division inside their nose, the septum, is slightly deviated. That could cause narrowing of the airways. So sometimes ENT surgeons they correct that. And again, in adults, sometimes they have large tonsils, or they have the soft palate, which is the soft part of the roof of your mouth. In some people, that can be very floppy. So sometimes they can kind of shorten that or make that a little bit stiffer. Or it, like I mentioned then earlier about someone's genetics or their anatomy, if they have a particularly small jaw, so when they lie back to sleep at night, the jaw again puts a bit more pressure on their airways.
Oh,
So in those cases, also sometimes they do a surgical adjustment to just bring the jaw a little bit forward. But
oh,
before they even surgery, so the ENT doctors, they sometimes suggest just wearing a mandibular adjustment device. So this is like a mouth guard that they
no.
will custom make for you to just try and bring the jaw forward. So if it's a problem with the jaw or the soft palate, they ask you to wear this first to see if that wearing that solves the sleep apnea that way.
That's actually good to know. I think while we're actually waiting for more people to call in, is there a need or do you think a lifestyle modification will have any impact on all this sleep apnea or all these issues?
Yeah, as with many chronic conditions, a lot of it starts with lifestyle changes as well. So
Mm,
the biggest risk factor is obesity and carrying extra weight. So by even reducing just 5 or 10% of your body weight can really reduce the number of times that you stop breathing, or it can be that you just breathe better, and that
mhm,
improves the sleep apnea on its own. That's because that losing that extra weight around the neck or like on the belly just relieves the
mhm,
pressure on the airways for the lungs, and
mhm,
that can be gradually build up with healthy eating, regular activity, and but and I don't want to also just simplify. It's like lose weight and it's easy, because this is one of those conditions that is very it goes both ways. So when I think about it, is that someone who has sleep apnea, let's say
mm,
they gradually develop it over time, as the way we are in our current eating environment, it's very easy to
mhm.
gain weight. So
Sure.
you can imagine a person gradually gaining weight over many years. They're
Mhm,
developing sleep apnea. That
mhm,
leaves them feeling very tired and sleepy during the day, and they're not able to do exercise or increase their activity.
mhm,
The feeling tired, irritable, naturally makes you hungry, and sometimes you want to eat more. So
mhm.
that makes the situation even worse. So it's not a condition that is I don't want to just say just lose weight, because it is difficult when you have sleep apnea
Mm,
and these other conditions as well. So it's important to be aware of it, and
mm,
if you are diagnosed with sleep apnea, then to get the help to lose weight to help with that in
mm,
terms of the lifestyle
mm,
things. Or if it
mm,
is severe enough that you need the machine,
mm,
it's not necessarily that you have to use the machine long term, because you can imagine straight away after you start using the machine, within a few days, people report that they're starting to feel better in terms of their energy. That means that they can eat healthier. That means they can be more active. Doing those lifestyle changes along with using the machine means that they can hopefully reverse it, and they may not need to depend on the machine in the long term.
So there's this question that actually one of my colleagues from work did ask that are me today, which I found a bit. I just need to be sure if there is any evidence-based findings or thing that is actually how true this information is. So the individuals did inform me that obviously the partner has a sleep apnea, and it's that bad that now they have to share room because she's losing sleep.
Yeah.
And she's not just losing sleep. She, at a point, she has to be taking sleep pills to kind of catch up for her sleep over the weekend. And it got to a state that she realized that if she doesn't take the pill, she probably will not be able to sleep anymore, even during the weekdays. Then she said her mom had the same experience with her dad, and the mom had onset Alzheimer's due to lack of sleep, which was caused by her dad. So, is there any correlation with because if you remember the first caller earlier on said, how do we support the carers, partners, you understand? So is there any correlation with lack of sleep? I know it's because obviously, and early set of dementia.
So dementia is such a complicated condition. It's often not just one single cause. It can be many single causes. Again, going back to the other things like, blood pressure, diabetes, high cholesterol, all those things, and sometimes genetics increase your risk of dementia over many years. Sleep is important, but it's not something that I can say is a direct cause of Alzheimer's. It can even sometimes, like researchers say, we don't even know if it's the other way around, because what happens with dementia, there's different types of dementia, but there's Alzheimer's dementia, and then there's like vascular dementia. So vascular dementia is when someone has a stroke or very many strokes over many times that develops dementia. But with Alzheimer's dementia, like they don't know as yet, is it that the lack of sleep may be a very, very early sign of dementia. So as in, like, we don't even realize yet. So it's not a very clear-cut answer. So I wouldn't be able to say that the lack of sleep led to dementia.
So
that answer has not been, doesn't have a lot of evidence just yet.
Evidence to back it up.
Sleep is, regardless, very important for your health, because it's something that allows your brain to get kind of rid of any kind of toxins in the brain, allows it to recover. So it is a very essential part of your brain health. And going back to, like, you're right, it really affects the partners of someone suffering with sleep apnea as well, which makes it even more important that the partner is treated so that the rest of the family also have good sleep as well.
Thank you so much. That's actually good, because I'm going to play this information so that the individual will actually get the feedback. So I think that's actually all the questions being covered. Is there any other information you want to give out before we wrap up the program?
I think we've covered a lot. So just if well, the thing that I would say is when we work as GPs, a lot of people come to us with saying that they're feeling tired. And sometimes, and often we will do the basic tests, like doing blood tests, check your thyroid function, anemia, things like that. But it might also be worth us asking your GP, could it be sleep apnea? And that can just prompt the GP to just do the questionnaires to see your risk of sleep apnea. And all it takes is just calculating the risk, and if needed, doing the referral. So it's not a very complicated thing to get diagnosed and getting the treatment. So just if someone is suffering from that daytime sleepiness, tiredness, just ask the GP, could it be sleep apnea? Sorry, got cut off there.
I'm back here. I didn't know you can hear me. So I was saying thank you so much for joining me on today's program. And I want to say sorry to our audience today. The network is out of control. There's nothing we can do about it. We've tried series of the Wi-Fi, we tried the phone, we're just switching from one place. So, but I'm saying it's actually been really an interesting topic. And I think I've learned a lot of the information you've been out today. And in terms of the father, we all know now that this is a condition that is treatable. People don't have to suffer in silence. And I was saying the fact that there is a treatment out there, and obviously there are 4 stages, and then the use of the machine, there's surgical treatments, and that's actually a good thing to know that this is actually because in those days, like say 10 years ago, the issue of apnea is actually a big issue within majority of people with obesity, in families, and like the first caller said, it's actually kind of separated some homes, because obviously they can't manage and cope together, sleeping with one another, and the man is not even aware of the condition, the side effect, the effects of lack of sleep that the other partner is going through. So I want to say thank you so much for sharing your knowledge with my audience today. I do appreciate. Thank you so much. And I want to say thank you so much to my beautiful fans on Facebook, and to my wonderful caller that called today. We are going to wrap it up now because the network is so bad. I don't want to lose Dr. Maurice. So if you have any other question, Dr. Maurice is on your Health Matters page. So if you have any question, just put it under the post. But please be aware, this is I just want to use the 5 minutes to quickly give an information. February this year, Facebook deletes live. We usually delete a live record after 3 months. So the Facebook, you understand, when you do a live video, after 3 months, they will delete it. So what I'm going to do, I'm going to be putting all the videos in YouTube now. And I'll be sharing the link so that people can go back and watch. So if I leave it on the main platform, after a couple of months, they're going to delete it, and there's nothing anybody. So I think it's global storage issue. So now we need to, because I don't want to be doing YouTube before, but now I think we need to open a YouTube. So I'll share the link, please. When we open the YouTube, it's not for monetization. Please join, subscribe, so that we can have enough people on there like we have on the Facebook. We have over 3,000 followers. Please, I'm appealing to everyone, when we share the link for the Facebook, please subscribe so that the video will be there, and other people, some people are actually busy, they can't join at the moment, and they can have the opportunity to work. So I want to say thank you so much once again to everybody, and do have a lovely evening. Bye.
Bye. Thank you for having us. Bye.
Thank you so much.